viewers, you all welcome back to another exciting episode of Glaucoma series on Clexcel Eye Care Services. If this is your first time on this channel, please don't forget to subscribe so that you will get very educative information on eye care and all eye care products. I am Dr. Agyenim-Boateng, and today I will be sharing with you my personal experience with glaucoma patients and their management. I will begin with cooperation. In glaucoma management, the ability for the patient to comply with whatever you, the doctor or eye care practitioner, is giving out is paramount, and it is one key of the success of the management of glaucoma. Because if you give all the quality service, all very good eye products, eye drops for glaucoma, and we all know glaucoma is lifelong, and the patient doesn't use it, the dosage, in terms of dosage, the frequency, the way you have prescribed to him or her, it will never help. The vision will continue to deteriorate. Secondly, will be consistency. In glaucoma management, I personally think consistency from the patient in terms of the doctor or practitioner to consult is also very important, because glaucoma management is always about comparing the present situation to the past. It's always about comparison. Either you are comparing the left eye to the right eye to see if there's changes, or you are comparing today's findings to the past records. So if the patient keeps changing hospital or from one doctor to another doctor, all the time the practitioner will have to start from somewhere, because he will not know what the pressure was, how the visual field was, what the other findings was previously. So it will be very difficult to get a baseline, so you have to start afresh. More especially those who haven't been diagnosed glaucoma, but they are suspects, they are on the borderline. So your doctor will tell you, maybe come in 2 years time and let me see if there is any change considerably for him to start treatment. Then you move to a different doctor. The different doctor too will see that change. Maybe there have been deterioration. If you had gone to the first doctor, he had documented, probably done visual field OCT and have the baseline for you. But because you moved to a different doctor, he too will have to look at it and say, oh, maybe come another 2 years and let me see if there is a change, because glaucoma should be a progressive optic neuropathy. If you see the neuropathy, unless you are very sure it is progressive, because before you can confidently say you have glaucoma, and then you probably will be starting treatment. The third one I would like to share will be very good counseling from the clinician. If the clinician is able to advise or counsel a person with glaucoma or a person suspected to be glaucoma very well, for him or her to understand how the condition is or how the condition behave, I'm very sure the patient will not the patient will take it serious, because they understand and they know the consequences if they don't take treatment serious, or if they don't take their schedules serious. They will know what will happen, because glaucoma will cause irreversible, all the damages are irreversible. So once they understand it in that way, then they will help you in whatever treatment options you're going to give them. Finally, glaucoma usually don't present in about 90% of glaucoma. We have few of them, we have few types. Glaucoma is a group of eye diseases that causes that progressive optic neuropathy. So we have very few of them that will present with symptoms. The acute type, you probably vomit, redness of the eye, very severe pains and other things. They are very small. Most of the glaucoma we see, they are the chronic open angle type. They don't present with any signs and symptoms unless a professional examiner examines the eye and then do further tests to arrive at a particular diagnosis. So if you're waiting to see probably my eye is red, swollen, I have pains, then it's glaucoma, or I can't see well, because glaucoma, the defects are always temporary in the beginning. So your vision will always be 6 out of 6. If you don't have any refractive error and if there's no other problem and your vision is 6/6, you will still have that 6/6 vision until very advanced stage. So by the time you realize you have a problem with your vision, it had already been advanced. So the number one rule is frequent eye examination, so that if there is any kind of suspicion, you either be advised or the management can begin as early as possible to prevent any nerve damage. And lastly, if you suspect someone of having glaucoma, it's always advisable, and it's one experience I learned from one senior eye nurse. She always advised her glaucoma patients to either bring all his or her immediate siblings or father or mother, or advise them to also go to an eye clinic for checkup, because we know glaucoma is genetic or hereditary. So it's possible, if you have or if you are suspicious, it's likely your siblings might also be having. So you advise anybody, if you go to hospital and the doctor says probably it looks like you have glaucoma or you have glaucoma, please don't keep it to yourself. Tell your siblings, tell your children if you have children, tell your mother or father if they are available, to also have their eyes screened, so that if they also unfortunately have signs of it, the treatment can start as early as possible to prevent any damages. Thank you very much, and please don't forget to subscribe to this channel, Clexcel Eye Services. We will be continuing to give you very educative information on eye care and all eye care services. Stay tuned. Bye.